All right, y'all. So I know in my last video I talked about a little about working at the nursing home, and so I want to tell y'all like my pay, how much I was making, and like my duties, what I had to do, other than pass medication. So first of all, they offered me $16 an hour. So I was so happy, y'all. I was like, ooh, I'm gonna be making all this money, $16. And it's 10 years ago, and I'm in the South. And I was just came from working at Wendy's, and I was making like $8.50. So I'm like, okay, I'm gonna make $16 an hour, you know. But I did negotiate with them a little bit, and so I ended up coming to $17 an hour. But mind you, this was 10 years ago. So after I got my pay and stuff together, I did my orientation. I remember my preceptor, her name was Ruth, and Ruth was very fast. And I'm naturally like a take my time kind of person. So at any rate, she ended up orienting me, and I got the information I needed to, you know, be on my own. And she also was a resource if I needed help. So after I got in my little flow of things, my duties were to be the charge nurse. They had a nurse manager, you know, on the unit I was working, and we had, according to which unit I was working on, we had 1 to maybe 2 CNAs at a time. And so of course I had to make sure first the medications, and then like after I got done with my medications, you know, really after I got done with my medications, I would like go assist in the dining room, feeding patients, and just helping the CNAs if they needed help, getting people up, because a lot of those patients, they go to a lot of activities, going with their family. And so, yeah, just doing stuff like that. And really, night shift did the chart check, but I did some chart checking, and that's when the doctors were writing orders, like handwriting the orders, and I used to have to put them in the system. And worked the 7 to 3 shifts, so I used to love it. Getting off early, still had, you know, my day ahead of me. You know, you just got to have a passion for that type of stuff, and you got to be patient, because these individuals they're old, and you just got to be patient. You can't expect them to do stuff quick. You got to be aware of, you know, their swallowing and making sure nobody don't choke, because aspiration is a big thing.